With Rayner lenses, the magic of sight returns. Quality of life is transformed as a faded and obscure world is made clear. Rayner, the manufacturer of the world's first intraocular lens, continues to create innovative and unique IOL designs and is the only British company manufacturing intraocular lenses. Rayner is proud to present C-Flex, a single-piece hydrophilic acrylic UV injectable lens, which is presented in an easy-to-use system pack. This, in addition to the intraocular lens, offers a single-use injector together with a pre-taped post-operative protective eye shield. C-Flex has many unique features, which greatly benefit both the patient and the ophthalmologist. The unique and patented design of C-Flex has been developed to provide superior stability in the eye, which results in an accurate, predictable and sustainable visual or refractive outcome for the patient. Let's look at how C-Flex achieves this superior stability. The C-Flex haptic design incorporates AVH technology, which results in controlled and progressive haptic compression in response to the contraction of the capsular bag, whilst still maintaining sufficient forces within the eye to maintain perfect centration. This animation shows how C-Flex behaves during capsular contraction. The initial overall diameter of the lens of 12 mm allows for sufficient compression to generate the necessary centration forces within the haptics. This force is created by a spring-like resistance of the haptic to the shrinking capsular bag. The outer haptic takes up the compression due to capsular contraction with a progressive resistance to contraction forces. The outer haptic begins to engage the inner haptic, and a new bending fulcrum is created. The haptic configuration assumes less flexibility, which is calculated to generate centration forces within the lens. The haptic tips gently meet the IOL optic and are effectively locked into position. The lens forms an oval configuration and is able to withstand excessive capsular contraction. AVH technology ensures that C-Flex does not vault anteriorly or posteriorly, which can affect the accuracy of refractive outcome. Furthermore, as we have seen, it ensures perfect centration, and this, coupled with a superb rotational and torsional stability, helps make C-Flex the lens of choice for many ophthalmologists. C-Flex is associated with low or reduced PCO rates, and this is directly attributable to the design of the optic, having a unique 360 degrees enhanced square edge. C-Flex is the only injectable single-piece intraocular lens incorporating an enhanced square edge. This unique and patented design feature offers a 360-degree barrier against the migration of lens epithelial cells across the haptic-optic junction. Studies also show that for the square edge to be effective, there must be at all times maximal optic posterior capsule contact. With C-Flex, this is achieved without the need for haptic angulation, a feature which, as we shall see, contributes to the ease of implantation. C-Flex is manufactured from Rayacryl, Rayner's own hydrophilic copolymer, which is one of the most biocompatible of all currently available intraocular lens biomaterials. Rayacryl is a hydrophilic acrylic copolymer of 2-hydroxy-ethyl methacrylate, HEMA, and methyl methacrylate, MMA, with a benzophenone UV blocker and an optimum water content of 26%. Rayakryl's relatively low refractive index, coupled with its superb optical clarity and freedom from glistenings or vacuoles, also contributes to a low incidence of dysphotopsia for C-Flex. Its well-documented low affinity for silicone oil means that for C-Flex, silicone oil-induced opacification is not a complication. C-Flex is recognized to be one of the most easily implanted intraocular lenses, either by manual folding or by using Rayner's single-use injection system. The equiconvex or equiconcave configuration and the uniplanar or non-angulated haptics ensure that C-Flex does not have a right or wrong way in the eye. The injector is a spring-loaded one-piece design incorporating a translucent loading bay and insertion tip. The loading flaps open to 90 degrees and the lens is inserted and folded over the ridge of the loading bay. The lens can be visualized as it moves along the bore of the injector tip and compresses as it travels. A significant feature of the injector tip is that it is tapered. Now we will observe the actual insertion of a C-Flex lens using the single-use injector. For the implantation of the C-Flex lens, the cataract is removed using phacoemulsification. Following cortical cleanup, the lens is inserted using the single-use injector as demonstrated here. The lens is injected straight into the capsular bag through a 2.85 to 3 mm incision. As the lens emerges from the injector tip, the leading haptic gently unfurls into the bag. This is followed by the optic body and trailing haptic, which can be easily placed, with the tip of the spring-loaded plunger, over the capsular excess rim. Once the residual viscoelastic has been removed, natural centration of the lens can be observed. In this next footage, the lens loading process is demonstrated. A suitable viscoelastic, such as Ray-Visc or Ray-Flow, is used to lubricate the lens to ensure a smooth movement within the single-use injector during insertion. The C-Flex lens is equibiconvex, and the haptics are uniplanar. Therefore, the lens can be inserted in any configuration without problems. However, if the surgeon wishes to dial the lens clockwise, then the lens should be placed into the bay, as shown here, in an inverted S configuration. The lens is then folded over the ridge of the loading bay, and the wings are clicked shut, being careful to ensure that the haptics are not caught. Once the lens has been placed into the loading bay of the injector, and carefully shut, the plunger is slowly depressed, pushing the lens forward, ready for injection. The lens should move progressively through the injector. If too much resistance is felt, the spring-loaded plunger tip can be withdrawn from the lens and then reapplied. This allows the lens to relax and ensures the lens is not overstressed during the injection process. Once the lens has been inserted through the wound, the plunger can be slowly depressed and the lens starts to emerge. This footage gives an excellent demonstration of the lens entering the capsular bag and illustrates the unique feature of the square-edge optic design. Finally, after viscoelastic removal, excellent centration of the lens can be observed. A larger version of C-Flex, Superflex, is also available with a 6.25 mm optic and an overall length of 12.5 mm. As Superflex is available from -10 diopters, it is particularly indicated for the larger myopic eye. Similarly, the larger optic diameter will make the lens very useful for those patients having a more active or mobile pupil, or for patients requiring more refined night vision. Toric lenses are now available. A new Rayacryl acrylic UV injectable IOL. The anti-vaulting haptics allow superb rotational stability and centration of the lens. The toric lens is made to order for patients' specific needs. Rayner is committed to the constant development of new technologies and product innovations, and we endeavour to continually meet the needs and wants of our customers. Rayner's continuous research and development into the key areas of materials technology and lens insertion methodology will ensure that the company will remain at the leading edge for many more years to come. A great British product, renewing sight for millions of people.